X-ray of an infant is showing double tract sign or a string sign, what could be the diagnosis? The answer is hypertrophic pyloric stenosis. If such X-ray finding is present, then which drug mother would have consumed during pregnancy? Correct answer is erythromycin. What will happen to a fetus if mother consumed danazol or misoprostol? Do you know the triad of yellow nail syndrome, Cartagner syndrome or Alport syndrome? To know the correct answer, watch the video till the end. Welcome back. So question number 1. String sign is seen in X-ray of the newborn or an infant. Which of the following is the probable diagnosis? You can see the string sign here. It is a part of congenital hypertrophic pyloric stenosis. The correct answer is option B, congenital hypertrophic pyloric stenosis. There could be also presence of double tract sign, which is shown here, or it could be a string sign. There could be a presence of dilated stomach as well as string sign or double tract sign on a barium mill. Question number 2. String sign is seen in X-ray of the newborn. Which drug would have been consumed by mother during pregnancy? This is also we have discussed in the beginning of the video. It could be erythromycin, valproate, warfarin or danazol. Correct answer to this question is option A, erythromycin. So erythromycin is associated with congenital hypertrophic pyloric stenosis. If mother consumed danazol, there could be a chances of virilization in fetus. If there is a consumption of misoprostol by mother during antenatal period, there could be a presence of Mobius syndrome. So we have to remember misoprostol for Mobius syndrome. Again the same image based question with the twist that string sign is seen in X-ray of the newborn. Which of the following surgery is done for this condition? Many a time this is also asked that which surgery is used for the particular surgical problem. Your options are Jatene repair, Norwood procedure, Nissen procedure or Ramstedt pyloromyotomy. The correct answer to this question is Ramstedt pyloromyotomy. So, whenever there is a pyloric stenosis, it is Ramstedt pylorotomy. If there is a TGA, that is transposition of great arteries, and newborn presents with cyanosis immediately after the birth, then the name of the surgical procedure is Jatene repair or arterial switch surgery. If there is a GERD, that is a gastroesophageal reflux disease, then Nissen fundoplication is done. If there is a hypoplastic left heart syndrome, that is known as HLLS, then Norwood procedure is seen. It is a complex procedure in which step by step the formation of the all chambers of the heart is done. So now the next question is what this image is showing. Is it a cephalophagus, craniopagus, occipitopagus or a pyopagus? We know that this is a conjoint twin which are attached from the cephalic part. You are tempted to mark cephalopagus, but this is not correct. The correct answer is craniopagus. So correct option is B, craniopagus. If the conjoint twins are ventrally attached, rostral, caudal or lateral, it could be omphallopagus, thoracopagus or a cephalopagus like shown in this picture, or it could be caudally attached, then it is called ischiopagus. If it is laterally attached, we can call it parapagus diprosperous. If it is attached like this way, we can call parapagus dicephalus. But if it is attached dorsally, like in this asked in question, then we have to call it craniopagus. If it is like this, we call rachiopagus, or if it is attached from the potty area, we call pyopagus. The image shown in condition that occurs due to deficiency of which one of the following? Your options are selenium, molybdenum, thiamine or niacin. We all know that is not these two. Any of one will be here. It's a classical picture showing a Keshan disease which occurs due to deficiency of selenium, and the presentation of the Keshan disease is endemic cardiomyopathy, cardiac disease, dilated cardiomyopathy. Specific order is which is present called Gierke order. Question number 6. A girl child seems to have episodes of daydreaming, zoning out, twitching of fingers and dropping of the object, particularly in the morning when she is either combing her hair or brushing her teeth. Her mother complained there is dropping of object for her hand and momentarily she is zoning out from the current scenario. Doctor said that it has a good prognosis and prescribed her sodium valproate. What could it be? It could be JME, chorioathetosis, tremor syndrome, or is a trick. It's a classical presentation of juvenile myoclonic epilepsy. It occurs due to GABRA1 Similarly, if you remember Dubin-Johnson, it is because of ABCC2, acrodermatitis enteropathica because of mutation in SLC39A4. Is clubbing a part of a triad of yellow nail syndrome? This was also asked in one of the Neet PG exam. Correct answer is no. Clubbing is not a part of yellow nail syndrome. So what is a triad of yellow nail syndrome? The classical triad of yellow nail syndrome is yellow nails, pitting edema, that is because of lymphedema, and there would be a respiratory symptoms. So what will happen to Cartagena syndrome? There will be a presence of sinusitis, dextrocardia or situs inversus and bronchiectasis. What will happen to Alport syndrome? We have to remember that there will be a involvement of three organs. One is renal, ear and eye. In a renal, there will be a progressive renal failure and there will be a blood in a urine. There will be ocular manifestation in a form of lenticonus, sensory neural hearing loss as well as type 4 collagen mutation. Most common cause of congenital hypothyroidism is a thyroid dysgenesis. Here the pointer is there will be no goiter because there is no thyroid gland. The second most common cause of congenital hypothyroidism is dyshomogenesis, where the presence of goiter will be there. Most common cause of acquired hypothyroidism is autoimmune thyroiditis. What is this image showing? It's a Trousseau sign which occurs in hypocalcemia latent tetany. We have to place and inflate the BP cuff, keep it for 1 to 3 minutes and watch for the spasm. If it is a severe hypocalcemia, the carpopedal spasm will occur without even placing and inflating the blood pressure cuff. What is Chvostek sign? That is also a part of hypocalcemia. How to elicit it? Tap the face just in front and below the ear. There will be a presence of facial twitching on the side of the face. Question number 1. 5-year-old child with rash, eczema, thrombocytopenia and recurrent sinopulmonary infection. What could be the probable diagnosis? Here there are 3 hints. It's a male child, boy, with rash, with thrombocytopenia, with recurrent infection. There are many clues which points toward a single condition among these 4 syndromes. Down syndromes, Noonan, William or Wiskott-Eldridge syndrome. Down syndrome, there are many facial dysmorphism which is not mentioned here. In Noonan also, it is not there. William, there are also many dysmorphism which is also not described here. This all condition classically fit into one syndrome, that is Wiskott-Eldridge syndrome. What is Wiskott-Eldridge syndrome? You have to remember mnemonic water. Wiskott-Eldridge stands for water. T stands for thrombocytopenia, E stands for eczema and R stands for recurrent bacterial infection. And this is a very classical picture of a boy presenting with thrombocytopenia as well as rashes with recurrent infection. So it's a triad of eczema, immunodeficiency and thrombocytopenia. So what is it and why it happens? It is X-linked recessive. X-linked recessive means it manifests in male and female will be carrier. It is genetic condition X-linked recessive in which there is a mutation in gene encoding WASP gene located at SP1123. Here IgG will be normal, IgM will be low. IgA and IgE would be elevated. So we have to remember the mnemonic. Chad's kinky wife got lucky. This is mnemonic to remember X-linked recessive disorder. Chad's kinky wife got lucky. So what are the other conditions with X-linked recessive? Chronic granulomatous disease, Hunter's disease, anhydrotic ectodermal dysplasia, dyskeratosis congenita, SCID, kinky, manky kinky hair disease, wife. W stands for Wiskott-Eldridge, I stands for ichthyosis, F stands for Fabry's disease, E stands for Ehlers-Danlos syndrome, G stands for G6PD and Lish-Nihan syndrome. So this is a very easy mnemonic to remember X-linked recessive disorders. But how we are going to remember the serological pointers toward Wiskott-Eldridge? We need to remember that after taking whiskey, ethyl alcohol goes up. So IgE and IgA will be increased, while IgM will be reduced and IgG will be normal. Mental orientation reduced, so M will be reduced and IgG will stay normal. Question number 2. Anomaly demonstrated in this image is associated with pre-existing diabetes mellitus, gestational diabetes mellitus, SE inhibitor and valproate used in mother, used by mother in antenatal period. What this image is showing, you can see there is a fusion of lower extremity. This is called cyrenomelia or caudal regression syndrome or mermaid syndrome. This mermaid syndrome is associated with infant of diabetic. Boot-shaped heart is seen in TOF, TGA, coarctation and VSD. Here it is boot-shaped heart and it points toward tetralogy of Fallot. Here we need to remember the component of TOP. So there is easy mnemonic to remember VSDH. V stands for VSD. S stands for stenosis of pulmonary valve, but you need to remember these two adjectives properly. That is progressive infundibular pulmonary stenosis. It means the child will present with progressive, the site will be infundibular. It means that child will not present with cyanosis on the first day of life. It is progressive. So the presentation of this cyanosis will be later in the life. Cyanosis presentation on the first day of the life in the newborn period. The first and foremost thing should come in a mind is TGA. D stands for overriding of aorta. Here D stands for overriding of aorta. H stands for hypertrophy of right ventricular, because there is a stenosis of pulmonary valve. Right ventricle has to work against the obstruction, so there will be hypertrophy of right ventricle. Progressive pulmonary stenosis, so baby will present late. Day 1, the very important differential diagnosis would be TGA. The next question is adult person with borderline hypertension with following X-ray showing. Here it is 3 sign or inverted E sign. What could be the diagnosis? TGA, TOF, coarctation of aorta, or none of the above? There are two important things pointed here. One is a notching of rib, as well as there is a 3 sign. So this is seen with the coarctation of the aorta. What is happening in the coarctation of the aorta? In the coarctation of the aorta, there is issue with the aorta. It means there is somewhere obstruction. So in the upper part there will be over congestion, in the lower limb there will be a less blood supply. So after some time there will be a formation of the collateral, and this collateral will pass from the inferior margin of the rib. So there will be a notching of the rib. Inferior margin of the rib will have a notching. So two important markers on the X-ray would be 1, 3 sign, as well as notching of inferior margin of ribs. These are the notching. One more important thing would be there would be a bounding upper limb pulse, feeble lower limb pulse, as well as notching in the ribs. Question number 5. This neonate is suffering from omphalocele, gastrochisis, umbilical hernia, or volvulus. What could be the answer? Here we can see the content of the abdomen is herniated out and there is no sac. So it points toward the gastrochisis. It is abdominal wall defect. Abdominal content is out but there is no sac. Now on the contrary, this neonate is suffering from, here also abdominal content is out. It doesn't look like intestine. Here it is probably kidney and liver. So, and there is a content, it is covered with sac. So is it omphalocele, gastrochisis, umbilical hernia, or volvulus? It is omphalocele. The content of the abdomen, it is also abdominal wall defect, but content of the abdomen will be covered properly by sac. Now very important thing related to strawberries. Strawberry tongue is seen in which condition? Kawasaki disease as well as scarlet disease. Kawasaki's disease is medium cell vasculitis, while strawberry gingiva is seen Wegener granulomatous, which is small vessel vasculitis. Strawberry gallbladder is seen in cholesterolosis, and strawberry vagina is seen fungal infection, that is trichomoniasis. Strawberry shaped skull is seen on antenatal USG in trisomy 18, while strawberry shaped scrotum is seen multiple sebaceous cyst. Question number 7. A child with hypercalcemia with supravalvular aortic stenosis with typical facial features like elfin face, broad smile and gregarious personality. It means outstanding personality. What could be the probable diagnosis? Down, Noonan, William, or Viscoeldridge? We know it is not a Viscoeldridge because there was no mention of any kind of eczema, immunodeficiency, of thrombocytopenia. These features are not definitely suggestive of Down or Noonan. So we are left with the only one option, that is Williams syndrome. But this is classical presentation of Williams syndrome. It's elfin face. Look at the smile of the elf and look at the smile of this child. There will be a broad smile, hypercalcemia, as well as supravalvular aortic stenosis. Next question, what is this tool and it is used for? This tool is called Shakir's tape. It is used for mid-upper arm circumference. The mid-upper arm circumference should be taken between the olecranon process of the ulna and acromion process of the scapula. The midpoint is taken, and if it is red, it means it is severe malnutrition. Yellow means moderate malnutrition. Green means child is normal. A 6-year-old girl can climb upstairs with alternate leg, knows her name, age and gender, but cannot narrate story. What is her actual age? Here we need to see a 6-year-old child cannot narrate story. A narrating story would come by the age of 4 years. So this child or this scenario is showing that this baby is having delayed milestone. But what is her actual age? We need to remember this story for it, that tree is rhyming with number 3. So at the age of 3, a boy can climb up and he is waving his hand. It means, and tells his name. It means that at the age of 3, child can climb upstairs with an alternate feet. Handedness is developed by the age of 3, as well as child will know his name, age and gender by the age of 3. So these are all things which should be done by the child who is 3 years old. But by the age of 4 years, child should narrate the story. So here the correct answer is option B, 3 years, because 4 years is out. By 4 years, child will be able to sing poem and stories. 2 years is also out because 2 years all this will not be seen. 5 years the child should narrate the story, and there should be another thing which child should be doing which is not mentioned here. So correct answer is option B, 3 years. A 3-year-old child is called having delayed milestone if he is not able to do one of the following. A 3-year-old child should be doing what? Now hop on a feet. 4 is having support of one limb. This is called hopping. So hopping will be developed at the age of 4 years, while skipping, that is jumping on both the limb, that is developed at the age of 5 years. Uses spoon effectively. Now we all know that by the age of 18 months to 24 months, child should learn how to feed himself without spillage. So by the 2 years, child should know how to use spoon effectively. So yes, this is correct. Now copy a square. If you remember drawing skill, by the age of 1.5 years, child know how to scribble. By the age of 2, child is able to draw the line. By the age of 3, circle should be there. By the age of 4 or 4.5, child should be able to draw the square as well as cross. By the age of 5, triangle, and by the age of 7 years, child would be able to draw the diamond. So according to this, the square should come by the age of 4 years. So it's not called delayed. So the correct answer to this question is use spoon effectively. A 2.5 kilogram neonate is born to primary with a mother by LSCS. Baby cried soon after the birth. However, the mother is HbS/Ag positive. What will be the further plan of management for this baby according to the protocol? The options are hepatitis B vaccine immediately, hepatitis B vaccine as well as hepatitis B immunoglobulin both as soon as possible, C, hepatitis B vaccine later, and hepatitis B immunoglobulin as soon as possible, hepatitis B immunoglobulin only. So what could be the answer to this question? In this scenario where the baby is born to the HbS/Ag positive mother, we have to give protection against the hepatitis B by both the way. Passive antibodies, that is hepatitis B immunoglobulin as soon as possible, preferably less than 72 hours of the delivery, as well as hepatitis B vaccine also to be given to provide active immunity for this child in a later future. Correct answer option B, hepatitis B vaccine as well as hepatitis B immunoglobulin as soon as possible. Now the next question is, what is this device? Where do you see it and what is the indication? So this device is called self-inflating bag. It is used in neonatal resuscitation protocol, and the indication for using this device is whenever there is apnea, gasping respiration, as well as heart rate of newborn less than 100. This device is having many parts. Many a times it is used in a OSCE sport also. Here what you see is a face mask. This is expiratory valve. This is pop-up valve, and there is one more attachment over here for PIP valve. This is bag itself. This is air inlet one-way valve. This is air inlet pressure release valve. This is called reservoir. Sometimes it is like this also, and sometimes it is in the form of corrugated tube also, and the other attachment over here is oxygen inlet. So what could be the contraindication of using following device during neonatal resuscitation protocol? We have already discussed this question, and the correct answer to this question is congenital diaphragmatic hernia. Because whenever there is a congenital diaphragmatic hernia, what is happen? This is the diaphragm, and here there are intestine and abdominal content. If there is a hernia here, if we use this device during the neonatal resuscitation protocol, the air is going to go inside. The more air will enter the inside of intestine and the stomach, this will cause excess of pressure in the lung, further compromising the respiration of the child. So the single most important contraindication of using this device is congenital diaphragmatic hernia. Surfactant first appear in the fetal lung by which week of the gestation? This is also we have discussed. This is just a number. We need to remember this number. The correct answer to this question is 20 weeks. There are few facts about the surfactant. It's a phospholipid protein. Its major constituent is lecithin, phosphatidylglycerol, apoprotein and cholesterol. And these are the things which has to be remembered because many a times it is asked. The first appearance of the surfactant in the fetal lung is by the 20 weeks of the gestation. Surfactant first appear in amniotic fluid by 28 weeks of gestation, but lung alveoli will have a surfactant by 33 to 35 weeks of the gestation. That's why the babies who are born less than 32 weeks of the gestation are more prone to have a respiratory distress syndrome. Surfactant formed by type 2 pneumatocyte. It is stored in a lamellar body, and the stimulus for the surfactant production is pulmonary fibroblast secreting FPF. Now FPF stands for fibroblast producing factor. During the approach to a newborn with suspected congenital heart disease, a pulse oximeter should be attached to. It means in a neonatal period, if we have any newborn who presents with the features of the cardiac failure cyanosis, then to measure the oxygen saturation of that baby, which limb has to be used? The options are right hand, right foot, left hand, or it is left foot. So correct answer to this question is right hand. Why? Why do we need to use a right hand? Here is the explanation to this answer. If you see the four chamber view of the heart, this is right atrium, this is right ventricle, this is left atrium and left ventricle. Left atrium receive the blood which is oxygenated from the lung by pulmonary veins. This will go to left ventricle, and this left ventricle have a origin of aorta. But in aorta, before there is a connection of the PDA, here there is a PDA. Before the even connection of the PDA, there is origin of the brachiocephalic artery and right subclavian artery, which give blood supply to our right hand. So this is called preductal saturation. If the preductal saturation is on the lower side, then it is almost sure that child is suffering from the congenital heart disease. So the best answer to this question is right hand. A 5-month-old boy presented with the following facial features. Which cardiac anomaly is common in this child? Now look at the facial features of this child. The facial features are suggestive of micrognathia as well as retrognathia, as well as if you see there will be a cleft in a soft palate, and there is a falling of the tongue backward because of a small jaw. So this all features fit into the Pierre-Robin sequence, and in a Pierre-Robin sequence the most common cardiac condition seen is a ventricular septal defect. What is the expected weight of the child aging 2 years? We need to know the formula. The best answer to this question, that at 2 years of the life we apply the formula of 2x plus 8. Here x is in a year, so 2 into 2 plus 8. So it will be 4 into 8. So quite straightforward answer is option B, 12 kg. So what are the formula? If it is less than 1 year, we need to do x plus 9 by 2, x is in month. Between 1 to 6 years, it is 2x plus 8, and if the child is more than 7 years of the life, it is 3x. I have made a very beautiful video on anthropometry. If you have not gone through it, please go through it. The link is in the description box, as well as there is I button. Following equipment is used for, look carefully, this instrument or equipment is used in an anthropometric assessment, where this instrument is called infantometer. This is used for the child who are less than 2 years of the age, where we cannot take the height as the child cannot stand properly, where we are going to take a length of the child. There we are going to use this instrument, and the correct answer is measuring length. Following equipment is used for measuring height, weight, skin fall thickness or crown rump height. This instrument is called stadiometer, and it is used for the measurement of the height for the child who can stand properly after the 2 years of the age. So following equipment is used for, what is this? This is nothing but this is Harpenden caliper. This is used for measuring skin fold thickness. So correct answer to this question is skin fold thickness. Now, waist classification is used in, Sarnet and Sarnet classification is used in, Silence classification is used in, and Gross classification is used in. Waist classification is used in acute hepatic encephalopathy. Here in stage 2 we will have a flapping tremors, this is asterixis. In 1 and 4 it will be absent. Silence classification is used for the osteogenesis imperfecta. Gross classification is used for tracheoesophageal fistula, and the Sarnet and Sarnet classification is used for the hypoxic ischemic encephalopathy in a neonate. Mouth and nose. The first is delayed dentition is called when there is no teeth eruption by the age of 13 months. It is mean plus 2 standard deviation. So what could be the causes delayed teeth eruption? It could be familial, rickets, idiopathic, endocrine causes such as hypothyroidism, hypoparathyroidism, as well as hypopituitarism, Down syndrome, cleidocranial dysplasia, or it could be progeria. The next is first sign of puberty in female is its thalarche. Thalarche is a development of the breast because of puberty hormone. While first sign of puberty in male is testicular enlargement. So this is a chart which we have to remember. In girls it starts with thalarche, then pubarche, then growth spurt, and then menarche. In boys it starts from below to down. First there will be a testicular enlargement, then there will be a penile enlargement, then pubic hair growth, then there will be a growth spurt, then axillary hair development, and then there will be a development of facial hair. The next is, in any sick child with medical emergency, ABCDE steps are performed. So what are these steps? A stands for airway, B for breathing, C for circulation, D is for disability, that is for neurological assessment, in which we see how child responds. Child is alert. B stands for child is responding to verbal stimulus. P, child responds to painful stimulus, and U stands for child is unconscious or unresponsive. E is exposure. Definition of severe acute malnutrition for the child who are between the age of 6 months to 5 years, defined as presence of one or more of weight for height less than 70% or minus 3Z score, severe wasting, mid upper arm circumference less than 11.5 centimeter, or there will be a symmetrical bipedal edema of the nutritional origin. So this is the difference between kwashiyorkyor and marasmus. In kwashiyorkyor there will be a presence of edema, here it will be absent. Sensorium, the child will be apathic and will not be interested in surrounding. Here the child will be alert. Appetite will be poor in kwashiyorkyor, here it will be voracious appetite. Hepatomegaly is more commonly seen in kwashiyorkyor, not seen in marasmus. Skin and hair changes are seen in kwashiyorkyor, not in marasmus. Prognosis is very poor, here the prognosis is good. Earliest symptoms of vitamin A deficiency is night blindness. But the earliest sign of vitamin A deficiency is conjunctival xerosis. Zinc deficiency can lead to growth failure, diarrhea, hypogonadism, alopecia, poor wound healing, as well as acrodermatitis and enteropathica. It's a rare genetic autosomal recessive disorder. There will be a mutation of gene of membrane protein that binds to zinc. The defective gene is SLC39A4. This is a classical picture of acrodermatitis enteropathica, in which the child will present with extensive rash, more commonly seen on all type of mucocutaneous junctions. Multiple fracture in antenatal USC, most likely diagnosis is osteogenesis imperfecta. It is also called brittle bone disease. The most common is autosomal dominant disorder. There is a triad of blue sclera, sensory neural hearing loss, and the fractures which can lead to bone deformities. Most common chromosomal abnormality in children is Down syndrome, and which is caused by maternal meiotic non-disjunction. 95% it is non-disjunction in maternal meiosis. 1% could be mosaic, rest could be translocation 21 and 14, and balanced translocation 21 by 21. Most common glycogen storage disorder in children is, we have already discussed at the beginning of video, it is von Gogh disease type 1 GST. How to remember this? Von Gogh disease, V stands for von Gogh, here GG. Von Gogh glucose 6 phosphatase is deficient, poor Pompe M, lysosomal M, alpha 1,4 glucosidase, CBH carbohydrate, C stands for chories, and after C, D will come. So, in chories, there will be a deficiency of D branching enzyme. Anderson, B comes after A. So, branching enzyme, McArdle, muscle glycogen phosphorylase, and H stands for glycogen phosphorylase. So these are the easiest way to remember the enzymes associated with glycogen storage disorders. In von Gogh disease, as there is no enzyme glucose 6 phosphate, no glucose formation from the glycogen, so it will present as hypoglycemia. As the excess of glycogen is stored in a liver, it will lead to hepatomegaly, renomegaly, there will be increased uric acid, increase in triglyceride, the face will be doll-like, and there will be a presence of acidosis. This is classical presentation of type 1 GST. I hope you all understood and learned well. Let me know what else you would like to learn from me. Till that time, take care of yourself, study hard as well as study smart. Bye.